I'm Dr. Samira Stewart-Altman at Central Veterinary Services, and I'd like to show you how we do a screening ultrasound for our pets here. So we have Cleo here on her back, and we are going to start by looking at the liver. So we're just checking all the lobes of the liver to make sure that they look nice and normal, which they do. And we even start to catch a little bit of her stomach in here, which has a little bit of gas in it. Then we scan over to her left, and this is her spleen. So we're going to check out her spleen. It looks great. As we come around her spleen, we see her left kidney. And then I like to come back around the liver to her right side. Where we see her right kidney. In between, we catch glimpses of her small intestine. And then we go back and forth in a grid pattern to make sure that we see her entire abdomen. If there's anything unusual, we stop and take a closer look at some measurements. And we come down to her bladder. That's why she's kicking a little bit. She has to pee. So that's her bladder. Looks nice and normal. And her bladder's this black spot in the middle. So in the bladder, we're looking for thickening of the wall, evidence of an infection, any bladder stones, and luckily I'm not seeing any of those things. Oh, tickles, Cleo. And then I come back up in a grid fashion again to make sure that I'm catching every internal organ in every angle possible. If there are any abnormalities, I'll save an image for later so that we can look at it again, and so that we can track progress of any abnormalities that we see. But luckily for Cleo, this is a routine scanning ultrasound and everything looks great.
I'm the Director of Medical Services here at Central. This is my dog Cleo. So after her ultrasound, we collected some blood and some urine. So I will show you how we run it on all of our machines here. Alright, so now that we're ready to run all of Cleo's blood, we're going to start with her CBC. So this is her whole blood here, and this machine here evaluates it and shows us her white blood cells, her red blood cells, as well as some clotting factors like her platelets. That machine takes about 30 seconds, and then we'll have results. The next machine we have is our chemistry machine. So this one will check her liver, kidneys, a number of internal organs to see those values. She's all preloaded here, so I'll just hit start, and the slides just go through, and the machine will pick up probes and collect her sample and run it through on each individualized slide. The next machine we have is called our kind of thyroid machine. This will take this cartridge in and then run it through and give us results on how her thyroid is working. Again, it goes in there. The final machine that we'll run through is on her urine. So this will evaluate her concentration, as well as if there's any crystals, bacteria, red blood cells, white blood cells. So we'll start with Cleo. So we'll select our SETI view. We'll hit run. And we'll take our sample here. And once it goes a cartridge in, we will insert her sample. And hit run. So while that's running, then I'll also run her stick, and this will tell us if there's any glucose or a number of other things within her urine. That just gets read in this guy here. Run that. And the final thing I'll do is her concentration of her urine. Put a couple drops there. And we look here. Perfect. All right, so that's all of her samples run, and we typically get all of our results within about 10 minutes or so.